Comprehensive Guide to Splinting for Fractures, Sprains, and Dislocations. Introduction. Hi and welcome. My name is Joseph. We will be mastering the key principles and practical skills of splinting. Let's have some fun. As a Level 3 First Aid class, we will be looking at the basics of splinting. Scenario 1. How to splint with items from a first aid kit. Scenario 2. How to splint with items from home. No first aid kit. Videos will be shown at the end. Practicing must be done to master the skills. To qualify, the skills of splinting must be done under the supervision of a trained and professional instructor. Circumstances for splinting in an emergency. Part 1. In an emergency, splinting is best practiced whether broken, sprained, or dislocated. We will be looking at the specific circumstances that warrant splinting in an emergency. Fractures. Broken bones requiring stabilization. Mechanism of injury can cause different types of fractures. Sprains. Ligament injuries that need immobilization for pain relief and recovery. Dislocations, joint injuries that require support and immobilization for proper healing. Part 2. Principles of splinting in an emergency. The key principles of splinting: immobilize, support, and minimize further injury. Immobilization, stabilizing the injured area to prevent movement and reduce pain. Calm and reassure, explain what needs to be done, and gain clear consent. Support, providing external support to the injured area for optimal protection as the injured person cannot use the limb as normal. RICE, rest, ice, compression, elevation. Rest, allow the patient to rest and not further use the injured limb. Ice, management with swelling. Compression, where possible, compress the injured area. Do not compress a fracture. Elevation, lift the limb above the heart when they are lying flat down. Minimizing further injury is the primary goal of treatment. Before splinting, check and compare limbs with one another, checking the CMS, circulation, movement and sensation, also feeling, protecting from further soft tissue injuries and pressure sores. Part 3. Demonstration of splinting techniques. Let's take a look at how to splint the wrist. If clear deformity is visible and no pulse is present, gently and promptly correct the limb. If unable to correct, splint as found. Here we have the wrist that we're going to splint. We have our splints that are there, our medical splints, and 2 bandages. First thing is to pull back any clothing or cut it off with scissors. You see the patient is wearing a watch. The injured area is just above the watch. We'll be checking capillary refill, is there good circulation, checking if there's a pulse, and checking the movement, known as the CMS, circulation, movement, and sensory. Removing the jewelry, rings, watches is very important, as this can constrict blood flow once swelling starts to occur. Explain to the patient what's happening. Measure the splint. Gently lift whether dislocated, broken, or sprained. This will hurt. Pop the bandage from the back, holding the plastic. Squeeze it out. Get enough bandage to firmly wrap around the injured area. Very important. Place the bandage above and below the injured area, never on top. There are many techniques of sliding the bandage underneath, in, sliding, putting. If one works alone, you'll have to get creative. You'll see there's a fold the bandage in half. Making a simple shoelace knot is effective and neat. If the bandage is too short, do not attempt to tighten it to make it fit. Rather use a different piece of bandage or longer. Once again, cutting. Folding the bandage in half, pulling it under the splint. Whatever works best, every situation is different. Nice and tight. Not too tight though. Enough to stabilize the wrist. It's important to make this comfortable for the patient. Afterwards, putting the wrist on a pillow or resting it in a position which is comfortable. Very important, the rest of the bandage, tuck it underneath into the palm for comfort. Checking the CMS again, pulse, circulation, movement, and we have good cap refill. Take note of the following: correct length, proper alignment, immobilization, securing of the splint. Ensure excellent and tidy splinting considering aesthetics and functionality. Now we will have this scenario where we do not have a first aid kit. Same again, pull back any clothing, check again CMS, good cap refill, pulse, remove jewelry, watches, rings, bracelets. Constantly explain to the patient what is happening. In this case, we will be using ice, and the splint will be the ice tray itself. Throwing the ice into a cloth, setting it aside for later use to manage the swelling, taking the splint, putting a plastic bag, normal plastic bags, over it for padding, not to create any pressure sores or soft tissue injuries. Gently lift the wrist, slide it underneath where it's comfortable and where it's functional. We are using more plastic bags as where earlier we used bandages. Here we will fold them elongated underneath the splint, over, and the plastic bags are too short for a shoelace knot, but they are rigid enough to stay in place with just a normal overhand knot. The starting of a shoelace knot. It's nicely tucked in. The other one below the injured area, another overhand, not too tight but tight enough. Very important to check again the circulation, pulse, movement, and how the cap refill is. Take another plastic bag, the same as we saw earlier, and tuck it into the palm area for comfort. And we will be using the ice in the cloth on top to manage the swelling. Minimizing further injury is the primary goal. I'm mentioning this again. Before splinting, check and compare limbs with one another and checking CMS. This is very important. Take note of the following: padding, comfort, support, immobilization, remove watches, rings and bracelets. Part 4, risks in splinting and risk mitigation. Risks associated with splinting: impaired circulation, nerve damage. Check to see CMS is present before and after splinting. Ensure proper padding and monitoring. CMS is being mentioned many times as this is crucial. Understanding the basics is key. If there is bleeding, stop the bleeding first. Remember to stay calm and think, plan and do as you have practiced. You can use anything as a splint as long as it serves its purpose. Discomfort or pain: if there is pain caused by the splint, support and adjust the splint if necessary. Seek medical assistance. Call for an ambulance. This number 10177 if the patient is unable to move. Splinting is important for the patient. When done correctly, pain can be managed and recovery can come sooner.